Chapter 6. Mastitis Prevention. As defined by Animal Health Ireland, mastitis is inflammation of the mammary gland. In cows, it is usually caused by bacteria which have entered the teat canal and moved to the udder. The bacteria multiply and cause a mastitis infection, which results in an inflamed udder. The cow's immune response to this infection results in a localized influx of inflammatory cells, seen as an increase in the somatic cell count, or SCC, of the milk in that quarter. Somatic cell count, or SCC, is the concentration of all body cells in milk. This count can be taken on an individual cow basis by milk recording, or as a bulk sample from the tank. It should be noted that evening milkings normally give a slightly higher SCC reading, and that concentrations vary throughout a milking. An elevated SCC reading is a result of a cow releasing large quantities of white blood cells into the mammary gland and into the milk, in response to the entry of bacteria into the udder. As an alternative to individual SCC milk recording or between recordings, a California milk test, CMT, may be carried out as shown here. This involves the use of a paddle with 4 separate plates, each containing a reagent. This should be mixed with an equal amount of milk from each quarter. The consistency of the reagent will turn from watery to gel or paste-like when milk from an infected quarter is mixed with it. It is only a general guideline of the presence of infection, but will not give an accurate reading of the severity like milk recording does. The main sources of bacteria causing mastitis can be divided into 2 types: contagious, that is cow to cow, and environmental, that is bacteria harboured in cows' housing, bedding, or handling facilities. The 2 main contagious bacteria are Staph aureus and Strep agalactiae. These bacteria are mainly spread at milking time through contact with infected bacteria on milkers' hands or gloves, milk liners, and through cross-flow of milk between clusters. Wearing clean gloves, good post-milking teat disinfection, washing hands after handling an infected cow, dipping or flushing clusters after milking an infected cow, and leaving these cows until last in the milking process will all help reduce the spread of bacteria. All liners should be replaced at regular intervals, 6 monthly or after 2,000 milkings, whichever comes first. Splashes during stripping may also be a source of bacteria, so care should be taken while stripping infected cows. The main types of environmental bacteria include Strep ubris and E. coli. Environmental mastitis causing bacteria may be found in cows' bedding, calving pens, manure, soil, etc. The high-risk period is immediately before and right through to the weeks after calving, as cows' natural defences are compromised and therefore susceptible. Prevention is through better management practices and routines, such as 1. Proper teat cleaning and disinfection, as well as the wearing of clean gloves when using intramammaries. 2. Keeping bedding clean and well limed, and cleaning or scraping passageways regularly. 3. Letting cows stand in a clean yard for 30 minutes after milking to allow teat canals to close before re-entering shed. 4. Cleaning and disinfecting calving pens after each cow and maintaining a clean bed. 5. Avoiding the creation of mucky areas around the farm by having roads or tracks in good repair, having sufficient stone around gaps and drinking troughs which endure significant traffic. The severity of mastitis ranges from subclinical to severe as follows. 1. Subclinical mastitis, where the only sign is increased SCC. 2. Chronic mastitis. Milk may be watery, lumps can sometimes be felt on the udder. 3. Mild clinical mastitis. Clots or flakes may be observed in milk. 4. Clinical mastitis. Clots are clearly visible in milk. 5. Acute clinical mastitis. Cow may or may not be sick with high temperature. Udder will be hot, swollen and sore to the touch. Clotted milk may contain blood. 6. Severe clinical mastitis. Cow is extremely sick. Some cases are fatal. The udder may become gangrenous, black in colour. Milk is watery, clotted and contains blood. All cows should be observed for signs of mastitis during preparation. Signs may include swollen and/or hard udder, hot or red quarter, clotted, discoloured, smelly or bloody foremilk. The infected quarter should be milked out fully, cleaned with water and dried, and cleaned again using an antiseptic agent or methylated spirits or a teat wipe. A clean gloved hand should be used throughout so as not to introduce bacteria to the teat canal. Finally, after marking the cow and recording her ear tag number, an approved mastitis intramammary antibiotic should be administered to the affected quarter by carefully inserting the tube to the teat canal, depositing the contents, and massaging it into the udder. The cow's milk should be withheld from the tank for the full recommended withdrawal period as stated in the manufacturer's instructions. Ideally, cows with a high cell count or clinical mastitis should be milked last where possible. If this is not feasible, the clusters used should be immediately dipped in an improved disinfectant solution or flushed if the system is fitted. If the cow is discovered to have severe mastitis, you must treat the cow as necessary with an appropriate injection or seek veterinary assistance. The cow should be marked properly before treatment and the number and details recorded on the notice board. If the symptoms warrant it, the cow will need to be drafted into another yard to await the arrival of the vet. It is important that you keep yourself and the parlour clean during milking and follow good preparation and consistent milking routine.